Let's workflow tonight.
Good afternoon, dental internet world. My name is Dr. Vishal Sharma, once again here, at least remotely, with my friend and colleague, Dr. Mike Parchewski. Mike, it's great to see you. We are venturing into the precipice of conference season. And on that note, it's a worthwhile time for you to key up our guest for today.
Well, great, Vishal. Good to see you, and even remotely. And a welcome, special welcome to Dr. Mel MacDonald, who joins us today from St. Albert, close to Edmonton. So not that far away from us, but a lot more mosquitoes there for sure. Mel, you have been an absolute force of dentistry in the last few years across Canada with CDOCs and Dentsply Sirona. And now you're going to be heading south of the border, headlining as the keynote speaker at with our very own Dr. Vishal at Las Vegas Dentsply Sirona World 2026, coming up in September. And first of all, Mel, just again, a welcome, and tell us about this event that you're going to be headlining, and what is the topic? Can you tease us with what you're going to be talking about, or is it on a need-to-know basis?
Yeah. Well, my outfit is on the DL, but I'm honored and privileged to have been asked to speak main stage first day at DS World. I'm excited. I'm going to talk a little bit about how I did this whole journey of my practice from opening a practice after being the longest, I think, associate in Alberta. I was an associate for 19 years before I decided that a great time during a global pandemic, I should do a startup. So that was about 6 years ago in October. And I just talk about how I wanted to build something very different from where I came from, how I leveraged and clung on to just about every digital workflow I could find, how I became a CEREC doctor, how I expanded my practice then 3 years later to now from 4 ops to 9. And now I have 2 associates and 16 team members. So yeah, it's been a ride and it's been fun.
Awesome. Well, it's great to have you. Now,
thanks.
Vishal, you're also going to be on the main stage, which I think is a long time coming personally. I've been, one of your big fans trying to get you on that main stage. And I'm super excited that if it's someone from DWD was going to get there, it'd be you. And I'm, personally super excited about it. And so tell us what you're going to be also handling there at DS World and maybe some of the other things that you're going to be managing for CDOCs there this year.
So I'll be serving as the entertainment. So mine will be a ventriloquist show, and I'll actually have a prime mill on my lap, and I have a technique where we can open and close the lid as a ventriloquist would do with the dummy. So it's quite the innovative presentation. Mel, I'm really looking forward to your presentation. I'm obviously very familiar with your inspiring story and the incredible career growth that you've had with your practice. Mine will be, Mike, on complex digital workflows and specialist collaboration. So essentially leveraging all the digital workflows that the three of us hold near and dear to simplify complex treatment, to simplify it into manageable, actionable, and bite-sized bits of sequential and streamlined procedures. So it'll be clear aligner therapy and CEREC zirconia veneers, first time presenting on zirconia veneers. The other one will be a full mouth rehabilitation, utilizing a variety of different materials, direct, indirect, etc. And then the last one will just be a little fun spoof on specialist collaboration and how effective DS Core is with communicating not only with other dentists, but also with the lab. So I'm looking forward to it. And I don't know, who knows? We might have a white tiger up there as well. You'll have to show up to see.
Yeah. Maybe you can give away some white tiger stuffed animals to the audience.
Oh, you're stealing my thunder there, Mike.
Teasing. Mike, you're giving a hands-on workshop out there. What are you talking about?
So mine's going to be on DS Core to Crown. And so talking about that workflow of doing CEREC through DS Core, So it's going to be hands-on, and there's going to be lots of hands-on this year. So it's going to be hands-on course. And so I'm really looking forward to, I really like hands-on programs where you're interactive and getting to work with the dentists there and helping them get better at the planning stages through DS Core. So looking forward to that for sure.
Mike, I was on the website today, mostly trying to figure out when my presentations are, what time they are. But I noticed that yours are sold out already. So over a month away from DS World, and you're already a hot commodity. So well done on that. Mel, what are you most excited about for this upcoming DS World, obviously, besides you being a keynote speaker? And why do you think it'll be special this year?
Well, DS World has moved to now every second year. So there won't be a DS World 2027, which, I mean, I'm a bit sad about it, but I think they really doubled down on the CE part of this conference, which I'm super proud of. I think that was a direction that it definitely needed to go. So DS World this year there's much more hands-on. It's very handsy this year. DS World 2026, very handsy. There's lots of hands-on workshops. I think the breakout sessions are extremely high caliber. You're actually getting CE from the main stage event too, which is unique for this year. So I think DS really listened to what doctors want when they come to these conferences and bring their teams and spend money on travel and hotels. So I'm excited. This is a different one this year.
Yeah, I think
I'm sure you both are aware, but once upon a time, Dentsply Sirona World was split between Orlando and Las Vegas every year. So I think the every 2 years in Las Vegas is actually a really good cadence. It allows you to really emphasize software, hardware releases, which don't come out annually or every single year. And I agree with you, Mel. I think we see the changing expectations of a different demographic that's now coming into mainstream dentistry, and, a younger demographic. They're just interested in different things than people of our vintage would have been. And I think the focus and the shift to education, high quality education, is a much needed one.
Yeah, I agree with you. I think it's going to be it's a step in the right direction for her.
Yeah. And my ventriloquism cannot be than David Spade's comedy show was. So that's the bar that I have set. Somewhere between David Spade and Seinfeld.
I think it'll fly. I think it'll be good. I'm looking forward to seeing that prime male just talking. It's going to be epic. I think that's why most people will be going. But I do feel like I agree with you that the hands-on approach is going to be great. People are really leaning towards that. Young dentists are looking for more mentorship and hands-on. Education is key. And I think, entertainment is great, but right now, I think with the way the world is and costs and inflation and cost to put gas in your car, people are like, if I'm going to make a trip, I want it to be worthwhile and have value on Monday morning. So I think that's what's exciting about this DS World, is that's going to be really the focus. What can you get done on Monday morning? And that's always been a big theme with CDocs, right? And the education is making sure that on Monday you're able to improve your ROI, improve your case acceptance, improve these new techniques on Monday. So I think that's going to be fabulous. Now, Mel, let's get back to not to, tell everybody your journey and stuff like that now, and let people miss that at the DS World. But, really, I think today we really want to talk about how you've leveled up your clinic and, how you've used your technology and really built something great, expanded. So walk us through a little bit about how technology and how, with your expansion, you're able to bring that patient experience and technology into the front and center of the experience when a patient walks in your door.
Yeah, I mean, I'll be very transparent. When I first opened up this place 6 years ago during a global pandemic, I did have a very different vision than the practice that I was at, and I had been an associate there for 10 years and 9 years before that at somewhere else. So I was an associate for 19 years, and I think I got to a point, and maybe the pandemic really made me think about it, is that I wanted to do dentistry different for myself, and I felt ready to make that jump. My plan was to open up Citadel Dental, work for 5 years, and sell it and sail off into the sunset. I mean, my husband's talking about retiring next year from his CFA job. That was going to be the plan. What I didn't anticipate is how much I would be enriched and excited to do dentistry differently. Like, that was the different piece that I wasn't anticipating. Like I said, I just wanted to get this startup running and get it seamless and then sell it off, and that was it. And what happened is that 3 years after I opened, and I'm like enjoying dentistry more than I've ever thought I could or would again, an opportunity came up for an expansion to a bay next door. So I took that. So no, I didn't sell it. I expanded it to twice its size. I got 2 associates who I enjoy working with. And I mean, they run the place like they own it when I'm not here, which is, often with all the travel that I do with CDocs and teaching and such. So it's a surprising journey, to be honest. Like, I never anticipated this when I was planning this out in my head, but I love every minute of it.
Such a great story. Like, Mike and I will both attest to the fact that ownership is certainly one of the most rewarding experiences you can have. Now, obviously, it's not without its significant multiple times per day trials and tribulations. But, when I sort of look back, and obviously I'm no longer an owner, mentoring, growing a team, seeing team members, and I know, Mel, you have this, Mike, you have this, succeed beyond just their initial role that they came in with. I think there's no better feeling from being a clinic owner / mentor leader than that. And kind of pivoting on to that, Mel, you've been being a mentor for other women in dentistry, also another admirable undertaking. How has that been, and what impact have you seen in this endeavor? Please talk about that.
Yeah, I mean, Dentsply started the First to 50 program almost 5 years ago, so 4.5 years ago, I believe. I was the first graduating class through that speaking class. So that initiative was them saying, you know what, with our KOLs and our speakers, we want 50% females. So they called it First to 50. They wanted to be the first dental company to have 50% representation of females as KOLs and as speakers. And it never in a million years, like when they approached me, I thought they were crazy. I'd never done any sort of public speaking. That was not my thing. Definitely could speak to patients in my team. And I think you underestimate how much that is actually public speaking. But what excited me and why I said yes is I can remember graduating from dental school 26 years ago. And I mean, I was a dental assistant before I was a dentist, and I would show up at big conferences and sit in a chair looking all young, way younger than I do today. And, sitting next to a dentist and them saying, oh, so who's the dentist to you? Who's the assistant? Like, oh, you're the assistant for which doctor? Like, they didn't even believe that I was a dentist. And like, I'd show them my badge, like, okay, no. Oh, so you're a hygienist? No, I'm a dentist. Like, they let us into school now. It's okay. And I and I just felt like you saw no one on stage, or no one, not that I think speakers just need to be, they need to be good no matter if they're male or female, but I think it allows females a different connection when they see someone that they can identify with and is maybe more like them than you and Mike.
It's incredible how the profession has changed, and obviously, being a pioneer, breaking through that. So I think it's a great program. It caused a little bit of confusion for Mike. When it first came out, he thought that 50 was who would get to 50 years of age first. And he's like, well, Vishal, I'm substantially older than you are, so I'm going to win that. And I had to explain to him that that's not actually what First to 50 was, but...
Yeah, I even had a hat made, said First to 50, just to rub it into you, Vish, and then that didn't work out.
Mike's a linguist. It said cinquante on there.
Yeah.
50.
Yeah. But,
so
yeah, go ahead.
Mel, but besides the involvement with Dentsply, you've got 2 female dentists, obviously working within your practice. What other initiatives or what other messaging do you have for young females entering the dental profession?
I think it's like, I hate to sound like a feminist, but I am a feminist. And I think, it's at times we haven't had the same voice. And I think now is the time that we do have a voice. And I think you can. I was always told, I'm going to tell you, when I was in dental school, and I won't name the name of the professor, but he taught practice management back in 1998-ish. And it was a test question on our exam. Who would be more profitable and have more production as a dentist, a male or a female? You had to answer male, because he's like, females have babies, females do this. They're not going to work as hard. They're not going to be as successful. And that narrative actually really did stick with me, even though I'm a dog mom. I'm not a child mom. I'm a dog mom. But I always kind of felt that from that narrative, I took it way too far, that I wouldn't be as successful. And I see it all the time. Colleagues that have extremely successful practices, that are moms, that, can do things, that are KOLs. Like my own associate, Dr. Laura, just had a baby 7 weeks ago. She was back at work working 1 day a week, like last week. Like, what a badass, like we can do it, and we are doing it. And I don't want females to feel pigeonholed anymore, or less, or that they don't deserve to be up on a big old stage. I don't know. Like, I think I think it's great. I think it's time. Dental classes now are 65% female. So
that's a big one. That's a big one. Yeah.
Yeah, we are the majority now. So I like that I can, mentor and be there for females when I didn't really have that, and actually was told that I was never going to be successful before I even graduated.
Now, and I agree with that, because, going back to that, with so many more women graduating from dentistry, I feel like then you have to also have that same mentorship, because I do agree with you that while, you can get the education, but it's also really important to get the mentor and the person that's passionate, that you can phone to message, as an example, you see what they're doing. I mean, you look at Leanna Lunt, and, I've heard stories of her working on patients, and her baby's over on the counter and she's crushing it, right? And, like just a powerhouse that she is. And women want those stories because they want to relate to that and know that it's okay to put career first. It's okay to juggle and to balance. And, I've worked with both of your associates, and fantastic individuals. Mel, like with your associates, how did you find them? How did you be, like, I know you've got them doing sort of, one's focused on more surgery, one's focused a bit more on cosmetics, is awesome on social media. How do you foster that relationship, and how do you keep that growth, keep them engaged? How do you make them 19-year associates?
They approached me. They were both at a point in their careers. Dr. Laura, I think, she'd done a residency at GPR at the U of A after graduation from U of T. Dr. Laura did she was an associate at a very 7-day-a-week, 12-hour-a-day clinic for 8 years. And so they came with 5 and 8 year experience, but they were working sort of the same year every year. Where they were associating at wasn't developing, it wasn't proactive. They weren't gaining any new skills. They certainly became very comfortable at the skills they had. But I think people with that kind of mindset keep wanting to progress. And so they saw I was expanding. And Dr. Jordana, I met at a pool at a conference in Maui, and she approached me and said, I've seen you before. I know you're expanding. I really want to become a digital dentist. I'm stuck in this paper clinic with no technology, and there's really nowhere else that it can go. And I really want to, if you have an opportunity, I would like to be a part of that. And I mean, she came to my clinic once a week for 6 months, just before we even inked anything. She was super committed. And Dr. Laura, the same thing. She approached me and said, I do a lot of surgery. I like placing implants, but I want to do it digitally. And I see you are that place, and I would like to be a part of that too. So, they kind of saw what I was building and wanted to be a part of it, which I think is a great, those are the people that you want, the ones that already have that mindset of excellence. Because that's much easier to mentor than somebody that just wants to live the same career every year for 30 years.
Yeah. Yeah. Hey, Vishal, I know, echoing what Mel is saying, I know you've been working a lot with Spears on growth and development of associates and developing programs for associates. What are you seeing in the industry for what associates are looking for, how to grow and develop them? What are you seeing that's happening mostly in North America, but what are you seeing?
Yeah. Well, Mel, that's an inspiring story. And obviously your associates both came in past that what we call early career dentist, or the foundational phase. They had acumen, they were experienced dentists, they had some level of proficiency, but what they were looking for was a partner who's going to be invested in their career growth. And that's what we're seeing with associates of all varieties, specifically in the US, where most new grads will, their first position is with a DSO. So it's that investment in their career and having a partner in their career progression. It's no longer an option that's seen as a fundamental component of associate recruitment. And then we are really seeing a readiness gap between what you're taught, the fundamentals from dental school, to the realities of private practice. And that readiness gap, I've observed that since, any of the three of us graduated, and specifically post-pandemic, it's starting to widen. So creating programs that can help shrink that gap to better prepare associates for the rigors of private practice, even if it's within a DSO, that will seem to increase career satisfaction. Mel, you just talked about how much you love practicing dentistry as much as you ever have. Mike feels the same way, depending on what day I catch him on. Some days, he looks like he's ready to go back and go into pharmacy or be a gym teacher. But it's a rewarding profession. But early career dentists, they don't have that same career satisfaction where, the majority of our friends and colleagues love dentistry. So it's a bit of a long-winded answer, a bit of a roundabout component, but involvement in your career progression, education that fills the gap and satisfies the pain points that they're having seem to be the main component. Yeah.
And I think there needs to be a responsibility of the principal dentist. I think I'm definitely not this way, but when you get someone that is wanting involvement and mentorship in their career, you don't just give them the MODBLs all day long, right? You've got to allow them to take on sure small cases. You know what? I'm not robbing all the high-end dentistry from them. I want them to do it. I will help them at every turn to do that. That was my responsibility to promise them that you're not just going to sit here and do the things I don't love anymore. I want you to do the things you love, and I'm going to help you love them and be successful. So I think that kind of mentorship doesn't always happen, but I was committed to make that happen here.
Yeah, and I think that's how. So
my next question. You answered my next question, Mel, on associate retention and the strategy. And so, yeah, it's a great answer. And I think you're right. Mentorship is a lost art. All of us at a certain point probably benefited from a mentor. And now we're finding that as it's our time to give back, and Mel, you're certainly an exception to this, and Mike, you are as well, but we're finding that less dentists are interested in that mentorship model. And I'm not sure why that paradigm shift has occurred. but it's a common component where even independent dental practices, certainly DSOs, that it lacks that mentorship. So your associates are certainly fortunate to have landed in the mosquito capital of Alberta.
Yeah, and I think it's always important not only to have mosquitoes in Edmonton, but I only think the only place in Canada right now that has bigger ones I hear is Winnipeg. But I think the key is that the mentorship for the young associates, there has to be an element that they are able to develop faster than if they were to have to repeat all of your steps. We do that with our kids, right? I don't want my kids to have to go through all the steps I did. I want them to short circuit that. I want them like, look, this is what I did. This is how you're going to be successful. I don't want them to have to make all the mistakes and go struggle and do all this. Sometimes they listen, sometimes they don't. But with associates, the same thing. Sometimes they listen, sometimes they don't. But I don't expect an associate to take all the CE and all that training that I did to finally do a cosmetic case. You know, it's like, listen, I'm going to give you all of the things and I'm going to support you on these cases so that you can, for save costs on this. Yes, you're passionate. Definitely you can go to COIS as many times as you want, for sure. But doesn't mean we can't start with fixing some worn bites, right? And so I think that's the biggest thing that I see is missing is that the dentists that are running the practice, owning the practice, are sometimes holding things close to them, holding that knowledge. And boy, it's so great and empowering when you let the associates grow by providing them that mentorship directly on those cases. So it's hugely helpful. And I've seen you do it with your associates. And I mean, you've got two powerhouses there that are driving their own niches, which is also very impressive. I think it's important that clinics, each person kind of finds their niche. And that's what I've done at my clinic. You know, I've got Amanda coming in. She does orthodontics and aligners and, you know, does it so well that I'm like, okay, yes, I can do Sure Smile, but nowhere near as good as you. So you take it. And it really unleashes you a little bit when you don't have to be good at everything.
Yeah, it really does. Like I despise surgery. I always have. It's not my thing. And it is just so freeing when I feel like I don't have to do that anymore because Laura is just incredible at it. And, you know, and like sharing my, you know, I went to the Spear Education Center right after it opened and took a whole bunch of courses from Frank Spear himself. And to be able to pass on that kind of knowledge and to break things up simply for Jordana so that she can kind of think like a holistic dentist, not just a single tooth dentist. It is really like, because they get so excited. So it is, I think, for clinic owners, maybe if they don't mentor, if you try it, it's so rewarding. It's like Mike seeing your kids like ski really well, and you're like, okay, well, I taught them how to ski, but now they can out ski me. Like it is incredibly rewarding. And I mean, at year 26 of your career, like I am, you got to find the things that still get you excited every day. And seeing them be so successful and so invested in this clinic is like, it's incredible.
And mentorship aside, even the business model of having multiple dentists who have complementary skill sets and capabilities is the best business model that I've seen. You know, one dentist concentrating on this, another has an expertise in this, a third has an expertise in this, with a lot of overlap, but everyone's got their own niche. That seems to be the secret sauce for a larger practice. So Mel, conference season coming up. What's coming up in and around Dentsply Sirona World besides DS World?
Okay.
Well, I got a bit of a busy next month. Well, next 3, I think. I'm giving a webinar the first week, I think, or September, or the second week, and that'll be on a Tuesday. I think it's a double webinar just on DI scanning and how that grows your practice. And then I head to Toronto on Wednesday to give my CL200, the CAD/CAM workflows and the entries CEREC workshop for 2 days, and then the prime print and the in-lab workshop the next 2 days. Just like you are, you're going to be there too with me teaching.
Same weekend, yeah.
Same weekend. And then I think I come home for 24 hours and then I'm off to DS World for rehearsals and everything around that.
Well, the nice thing about having the webinar before DS World is you can be like Chris Rock or Nate Bargatze, and you can test out your humor almost go to a local comedy show. So you can see if your jokes work or if they fall flat. So yeah, maybe I'll show up with my ventriloquist act at the same time.
Please do. Webinars are tough because you just feel like you're talking to a screen and you don't get much feedback and you don't know if anyone's getting your jokes, and
you just have to go. That's been my experience, is not pausing for feedback. Save it till the end. Yeah. You just have to go. So
often people don't get my jokes. My assistants hate my same joke that I have. My reach isn't very far. So
as long as you have your go-tos, that's the key component.
I just don't know how you're going to carry this prime mill everywhere you go. That's what I want to see.
Strong lats.
It's heavy, man. It's heavy.
He's been farming, basically building his acreage. So he's farm tough now.
That's right. It's like that caricature where the one guy only works out his right hand. So that's the right side. So that's where I've been carrying the prime mill here. So I'm very, very misproportionate. But
so you have to pose in one direction.
Looking forward to seeing your presentation at DS World, Mel. It'll be a lot of fun having a fairly significant Canadian content on the main stage.
Yeah, that's really great this year. And I'm looking forward to seeing you guys too. Mike, I have to get someone to pull me a favor to attend your workshops. They're sold out. I looked today.
Well, I can sneak in.
Okay, good.
Yeah, you can have my chair. I'll just introduce you. And Mel's back.
Well, I know we've been talking about getting together on your podcast, but thanks for having me. It's been really fun.
Yeah, this is a great conversation. Thank you for sharing.
Yeah, thank you guys for having me.
Yeah, thanks so much. And, just to summarize it for everybody, you want to level up your clinic, level up your associates. That's the way to go, and level up your technology. And if you're interested in leveling up your technology, Dentsply Sirona World's right around the corner. End of September, please sign up and come down and see some amazing main stage characters here and caricatures. Take care, everybody. Like and subscribe. Thank you so much to Vishal and Mel. Be well, everybody. And remember, at Digital Workflow Dentistry, check out our links. Take care.